Let me now turn to Dr. Acton. Dr. Acton?
We have now reached 557 deaths in Ohio, and including.
Can you just talk about the importance of antibody tests, where we are with that, and then also what we know about how long people stay immune when they've recovered?
Thank you. No one really knows the answer yet to the immunity. As I mentioned yesterday, we would love, and a couple weeks ago, the big buzz was having a test that can show you had it. And almost in some countries, they're looking at certificates to say that, and then that you were immune and therefore kind of able to go about your business. And I think that would be a dream thing if we can get to something like that. But the science is ever shifting. We do not have many of those tests available yet. We're hoping in the state this week. Celix, we're waiting for the 1,000 tests that they promised us this week. And that will begin a study. About the antibody testing, there's a really innovative project going on right now at OSU, and they're working with Battelle. There are many people right now trying to find the right tests that we can do antibody testing on, not just to tell us if you've ever had it, which is all I need to do, figure out the prevalence in Ohio with our 1,000 tests. But we really would like to see if we know that you've actually really built up the immunity, that it's almost like a vaccine, that you were vaccinated, that you have that level of immunity. Again, that's the science fiction stuff that itself is miraculous right now. I wouldn't be surprised if we get somewhere on this. Will it be in the next week or two? No, but I think all the scientists in the world are rushing to answer your question. Again, we are still at about deaths in about 4% of our cases. So this is, again, a very lethal disease. Again, we know our numbers are still the tip of the iceberg because we're not testing many of the cases. Not just sit back and watch this virus unfold, but really get a lot more aggressive and take it to the virus. We don't want to just flatten this curve. We want to stay ahead of the curve. And we are all enduring what was a blunt instrument, a blunt surgical tool of the social distancing we're doing. But in the future, we really see a path where we have a much broader range of tools to fight this war. We all know that we're going to need to live with this virus, and we're going to live with it for a while to come, at least 18 months. And then you have to do contact tracing, which means, again, those disease detectives who talk to you when you're a case and find out everyone you've been in relationship with, anywhere you've gone in the past 14 days. And then those contact tracers reach out to those people and tell them to quarantine for 14 days. And when we have enough testing, test those folks. And in doing that, you can start to snuff out what could be the spread of the virus. This army of workforce, because the people we had who usually do contact tracing were, public health department-led epidemiologists. But because this is a global pandemic, the scope is so big, you need an army. You need 10 to 15 people per 100,000 population. And that is the army we've been building and are continuing to build. We are sitting around thinking, how do we live in this new world? Lastly, I do want to say ways to make it as safe as possible. So it really is going to be a partnership way beyond. This isn't just a government thing. This is really the whole private sector, all our best ingenuity being put to the test to try to figure this out alongside the health and the science. So I think we'll see a lot of innovation yet to come and these answers yet to unfold in ways that none of us would have dreamed possible. Some very blanketed ways, like it was a quick shutdown. And really, again, when they write the history books on this, I mean, it's pretty much a miraculous thing that we did, and it's really the people at home who have done this. But those policies were made boom, 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 and you couldn't get, these are very hard things to get in the weeds on. Now with some time, we have whole teams forming and working on each of those nuanced things. Ultimately gives us better control, better ability to find the person who has it, and also test their contacts. Right now, we're keeping those tests to such a small group of our population. We're having to, there's a team of people and some other team systems that never existed before. We are making government act in ways it never has in the middle of an emergency. We are building relationships across industries that did not exist in the middle of an emergency. And what's gluing it together, quite honestly, in Ohio, again, I'd like it to look all pretty for you, that we have literally been building it as we go. Bottom line is most people haven't been exposed and aren't immune yet. And so the second we all go about and interact with each other, we should anticipate that we will spread the virus to more people and that we will see more cases and more people get sick.